Good afternoon, students. Welcome in HCP lecture. Today I will start the revision of hospital and clinical pharmacy. In that, part 2, that is clinical pharmacy. Chapter drug and clinical toxicity. Okay. In previous lecture, we have studied these all points. First is introduction, then classification of poisons, then general treatment of poisoning, then insecticides poisoning, heavy metal poisoning, then barbiturate poisoning, and last is narcotic poisoning. Okay, I will revise in short all these points in this lecture. Now, first point is introduction. In introduction, we have studied the poisons are generally used for the suicidal purpose. In that, potassium cyanide, then oxalic acid, hydrocyanic acid, opium, barbiturates and organophosphorus compounds and arsenic. Okay. Then next is poisons used for the homicidal purpose are arsenic, antimony, then aconites, organic phosphorus compounds, then strychnine and oleanders. Then next is the poisons used for the stupefying purpose are datura, belladonna, then hyoscyamus, cannabis indica, then cigarettes containing arsenic. Then accidental poisoning commonly occurs as a result of carelessness with the poisonous, and non-poisoning have been reported from the greater use of chemical in industry and for household purpose. Okay, these are the introductory part of drug in clinical toxicity. Then next point is classification of poison. In that, poisons are classified according to their mode of action. Accordingly, poisons are classified into the three main groups. First is corrosive, then second irritant, and third is neurotics. Okay, then in corrosive poisons is simply a highly active irritant and not only produces the inflammation but also acute ulceration of tissue. For example, strong acid like sulfuric acid, nitric acid, and hydrochloric acid. Then next is irritants. Irritants poisons produce the symptoms of pain in the abdomen, vomiting, and purging. Corrosive in dilute solutions acts as irritants. For example, irritants are first is organic, then inorganic, and mechanical. Okay. First, inorganic. Inorganic are the non-metallic and metallic compounds. The non-metallic poisons are phosphorus, chlorine, bromine, iodine, and boron. The metallic poisons are arsenic, antimony, mercury, silver, iron, copper, bismuth, and lead. These are the inorganic poison. Then organic. The organic poisons can be divided in two types. First is vegetable poisons include castor oil, then colocynth, ergot, marking, nut, and aloes. Then second is the animal poisons consist of the catharids, snake venom, then scorpion's venom, and poisons insects. Then third is the mechanical. These groups include the powdered glass, choppered high, sponges, and diamond dust. And third type is neurotics. In that, these poisons primarily act on the central nervous system. Neurotics poisons primarily act on the CNS, that is central nervous system. The chief symptoms of this type of poisoning include the headache, drowsiness, then giddiness, delirium, stupor, coma, and sometimes paralysis. Okay, these are the classification of poison. First is corrosive, irritant, and last neurotics. Then irritants again, for example, irritants of example inorganic, organic, and mechanical. Okay, and organic again divided into the two parts. First is vegetable poison include castor oil, then colocynth, ergot, marking nuts, and aloes. And second is the animal poison consist of the catharids, snakes venom, scorpion venom, and poison insects. Okay. Now see the next point is general treatment of poisoning. In that, poisons is in relatively small amount may cause the structural damage or functional disturbance in the body. Poisons can be accidental, suicidal, and homicidal. Then the victim needs immediate treatment. It involves the following measure. First is immediate care of deteriorating body functions, then removal of the unabsorbed poison, then elimination of absorbed poison, and use of antidotes, and last is supportive measures. Okay. Then systemic antidotes. Such substances produce the opposite action of effects that of poisons. These are the administered with care because of antagonism always not complete. The antidotes itself may produce the unwanted effect. For example, Val, EDTA, salt. Okay. Then next is insecticides poisoning. In that, may of these insecticides contains the first organophosphorus compound and DDT. First, now see the first is organophosphorus compound. In that, symptoms and treatments. Okay. First symptoms of organophosphorus compounds is headache, then irritation of eye, nose and throat, then burning vision, cough followed by the vomiting with abdominal pain, then in severe case salivation, then nervousness and convulsion may occur. If not attended in the time, respiratory failure, coma, and finally death may occur. These are the symptoms of organophosphorus compound. Then treatment involve the following step. First is decontamination, second emesis, then gastric lavage, antidotes, then use of the cholinesterase activator, and last is other measures. Okay. Then next point is heavy metal poisoning. In that, first is arsenic poisoning, then second lead poisoning, and third mercury poisoning. Now see the first is arsenic poisoning. In that, acute arsenic poisoning and chronic arsenic poisoning. Okay. In acute arsenic poisoning, a specific form of arsenic, that is As2O3, that is arsenic trioxide. Okay. Readily available and has appearance of sugar, through it is rare but responsible for the acute poisoning. Then symptoms: gastrointestinal tract discomfort, then burning pain of lips and stomach, etc. Then vomiting with stomach contents followed by the greenish and blackish mucus fluid. Then vomiting later on followed by diarrhea. Then muscular cramps and convulsions. Then visual disturbances. These are the symptoms of acute arsenic poisoning. Then treatment: first is gastric lavage with warm water, then emetics like the mustard and zinc sulfate are used, then freshly prepared hydrated ferric oxide is introduced in the stomach as an antidote, which converts the arsenious acid in non-toxic formic arsenate. Okay. Then dimercaprol, that is BAL, 2.5 to 3 mg per kg every 4 hours, IM for 2 days, every 6 hours for 10 days, and every 12 hours till symptoms disappear. Okay. Then chronic arsenic poisoning. In that, chronic poisoning consists of the number of stages of symptoms may result after. First is acute attack, and second is accidental consumption of small dosage either in the drink or food. Then symptoms: first stage of GIT disturbances, second stage of catarrhal changes, then skin rashes, then nervous disturbances, and treatment of chronic arsenic poisoning is removal of victim from further exposure. Then sodium thiosulfate, that is sodium thiosulfate, 1 gram in 10 ml SWFI, then 2 to 3 times per week for couple of months by IV routes. Then dimercaprol 3 mg per kg every 6 hours by a week and every 12 hours for several weeks by IM route. Then lead poisoning. In that, lead poisoning usually is the by oral, respiratory or cutaneous route. Then color paints, glass and petroleum industries use lead. Then children play with toys and suck them. Then fumes resulting from the glass and petrol burning are inhaled. Then lead is accumulated in RBCs, liver, kidney and bones. Then acute poisoning is rare. Acute poisoning occurs very rare. The homicidal and suicidal cases are not seen. Then we have seen the symptoms, treatment, in previous lecture. Then chronic poisoning, it is commonly known as plumbism. Chronic lead poisoning is the done over the prolonged period of time. Then mainly it is seen in the children playing with the or in workers of printing and petroleum industry. Then symptoms, general symptoms like metallic taste, constipation and cramps. Then lead lines, anemia, lead palsy. Then treatment, removal of victim from the further exposure. Then excretion of accumulated lead in the body can be facilitated by acidosis. Then CADTA used as in acute poisoning. Then dimercaprol is also given with editate in a dose of 4 mg kg every 4 mg per kg every 4 to 6 hours by IM route. Then nemercuric poisoning. In mercury poisoning, environmental pollution in the source of mercury poisoning, workers working in miner, thermometer, barometer and electrical industries are exposed to the poisoning. Then acute poisoning and chronic poisoning, in that symptoms and treatment of both we have seen in previous lecture. Now see the barbiturate poisoning. In that these compounds are mainly used to as a sedative and hypnotics. They were also used as the psychotic and anti-epileptics. Symptoms of barbiturate poisoning may first is may cause excitement, then restlessness and mental confusion, then slowed speech and delirium, then respiratory depression, hypertension and muscular weakness, then coma, finally death due to the respiratory failure. These are the symptoms of barbiturate poisoning. Then next is treatment, gastric lavage by using the potassium permanganate solution or suspension of charcoal. Then hypertensive like Metarnenol in the dose of 2.5 mg by the IV may be given. Then use of the analeptics which stimulate the CNS. Then use of the forced osmotic diuretic like mannitol 20% of 500 ml solution. Then last point is the narcotic poisoning. These groups of the poisons is known as the somniferous. Then their preparations are used therapeutically to reduce the pain and produce the sleep. Okay, the main poisons in this group are opium and pethidine. Opium is obtained by the incision of unripe fruit of poppy plant called as the papaver somniferous. Then symptoms of narcotic poisoning. The symptoms of opium poisoning can be categorized in the following stage. First stage is stage of excitement, second stage of spore, and third stage is stage of narcosis. Stage of excitement, in that initially well-being and comfort with pleasurable mental excitement lasts for very short duration. Then euphoria, later with increased heart rate. Then stage of 4, in that the stage of excitement is followed headache, giddiness, a sense of weight in limbs, then strong tendency to the sleep, etc. Then third stage is narcosis. In that patient goes into the deep coma and blood pressure falls. Then treatment of opium poisoning. First is gastric lavage with water and potassium permanganates solution in ratio of 1:1000. Then purgative like the magnesium sulfate, that is 15 ml orally can be given. Then 1.5 mg atropine can be useful. And last is artificial respiration may be given. Okay, here are complete the chapter number 8, that is drug in clinical toxicity. These are the important questions related to this chapter. After watching this video, all students are able to answer this question. Okay. Now I will stop here. In next lecture, I will start the new chapter from part 1, hospital pharmacy. Chapter is 9, that is hospital formulary system. Okay. Now I will stop here. Thank you.